I am here with 2026 Central Washington University Athletic Hall of Fame inductee, Dr. Richard Roux. For starters, congratulations, Dr. Roux, on your induction. Why don't you start us off with what does being inducted into the Athletic Hall of Fame at Central mean to you?
Well, it really means a great deal to me. Sports medicine has been a huge part of my professional career, and Central has been really a highlight of that. Um, I really enjoyed all the professional relationships I had with athletic directors, trainers over the years, university presidents. Um, et cetera, with everyone, and especially with the student athletes. And they're the reason we do sports medicine. And um, I really enjoyed working with them and trying to keep them healthy or get them back to good health.
Mhm. And so you were with or Orthopedics Northwest, now Multicare,
Yeah.
for over 30 years. Kind of walk me through how you ended up in Yakima, Washington, following your studies.
So going to my studies, I as an undergraduate, I graduated from Stanford University with a BS in biology, and then I got a master's degree also from Stanford in biology. And then I went to medical school at UCSD, University of California, San Diego. And when I was at UCSD, I got interested in research, and I did quite a bit of research, especially in how musculoskeletal tissues heal and their mechanical properties. And so that got me interested in sports medicine. And then I went to Harvard for my residency in orthopedic surgery. And after that, I stayed at Harvard for 2 years and did a fellowship in orthopedic sports medicine. And then after that, I came to Yakima to practice at Orthopedics Northwest, which was then Orthopedic and Fracture Clinic, Yakima Orthopedic and Fracture Clinic, and names have changed over the years.
Perfect. And so that you started answering
So,
my next. Oh,
well, how I got there. So that was my background. And one thing to understand is that a lot of orthopedic jobs go on referrals and people that you know over time. And when I was at Harvard, a lot of the faculty there was from Duke University and vice
yeah.
versa.
Mhm.
And one of my favorite professors had gone to Duke, and he was very good friends with Todd Orvald, Dr. Todd Orvald, who was at Orthopedics Northwest then. And um, Dr. Orvald actually came out to Boston and recruited me and was saying how they really needed a fellowship trained sports medicine physician in Central Washington. So I guess the short answer is Dr. Orvald came out and recruited me. And when my wife and I came here, we both liked it. She's a physician too, Dr. Michelle Murray. She's a radiologist. And at the time, they needed a radiologist and they needed a sports medicine doc, and we really liked it here, so we came, and it was a good choice.
Uh, we love when you hear that Central Washington becomes your home. I
Yeah.
felt that. All right. And so you kind of started to answer my next question, but how did you become involved with helping out specifically CWU student athletes?
So when I came, like I said, I was really the first fellowship trained sports medicine, orthopedic sports medicine doc in Central Washington, and that did a lot to build my practice.
Mhm.
Sorry about that.
Oh,
That did a lot to build my practice. And then students and especially student athletes from Central started to come to me even before I was the physician there. And at the time, Gary Smith was the head athletic
oh, yeah. Mhm.
trainer, and Dr. Gary Frederick was the athletic director. And so, first Gary and then later Dr. Frederick said, "Hey, we'd really like to have you come up." And it started out with me covering some football events, college football games, and then it led to really being the team physician across the entire sports line at CWU. Um, so that's really how I came up there, and I'm really happy for that because I've loved my time at CWU.
I know you've definitely been one of the more cherished individuals around here, especially with those that have suffered some injuries. So I'm sure they appreciate you just as much as you appreciate them.
Well, that's nice of you to say. I appreciate it.
All right, my next question is for about a little bit about your career. You focused and prided yourself on some minimally invasive knee procedures in particular. How did that expertise kind of shape the way that you approached caring, maybe not only for collegiate athletes, but for others as well in the community?
Well, first of all, I really believe in minimally invasive techniques. A lot of what we do is tremendously invasive, even when we use minimally invasive techniques. And oftentimes, especially in sports medicine, we're rebuilding ligaments or reconstructing ligaments or repairing menisci. And sometimes, we have pretty devastating injuries where we might be putting together every ligament in a knee and menisci and other things. And so you want to do as little harm with your approach as you can and preserve as much normal function as you can. So part of the reason I got involved in sports medicine is I really enjoy doing those types of surgeries. It's a challenge that I've accepted and worked hard to get good at. And so, that led me to do it. And then in terms of, I've been around athletics all my life. I come from a family of athletes. My two daughters are athletic. I've been a athlete, a parent, a coach, a team physician at both the collegiate and the professional level, and an orthopedic surgeon. So I'm just attracted to that type of medicine and that type of care. And I believe in both preventative medicine and then curative medicine or, treating people. And all of those aspects have been attractive to me. And that's why I got interested in sports medicine.
Well, I think you definitely chose the right career path, especially if you have passion about it. It's like they say, if you love it, you're never going to work a day in your life.
And that's really true. I agree with that.
All right. So, from your perspective, how important do you believe the relationship between physicians, athletic trainers, and coaches is in helping keep student athletes healthy and able to compete?
Well, it's everything, and it's really, the reason I was so happily able to do 30 plus years at Central. Everything was collaborative. Working with the athletic directors, we always had their support. Working with the trainers, they're the ones that do the most work and the hardest work, and they're every single day, and that collaboration really, really valuable to me. And then at Central, we've been blessed with really good coaches, especially to me from a medical standpoint, because they were always looking out for their student athletes. Um, and I was never pressured to get somebody back too soon or anything like that. I was always supported across the board by the coaches, especially the ATCs and the athletic directors, to do the right thing for that student athlete's help. And that's really a tremendous environment, and it doesn't exist everywhere, but it certainly does at Central. Um, when you mentioned this, I think I wrote just a little thing down about the ATCs, and I was just thinking that their professionalism, their leadership, their caring attitude and communication and deep understanding athletic care allowed them to really help me take care of the patients, the student athletes, and also to get involved with preventative measures. So, I give all the credit in the world to the ATCs, the athletic trainers. And then, the coaches, um, they're out there to develop players and win games and things like that. But to me, their number one motivation was taking care of and developing their student athletes to make them better take on the challenges of life. And I love that.
Mhm.
Um, and then the athletic directors like Dr. Dennis Francois, just purely supportive of the athletes that we take care of. Um, and during my time at Central, I served under several different athletic directors, all of whom were wonderful student athlete advocates. But with Dennis, he was an unwavering advocate for athlete health, safety, and a thoughtful collaborator and a trusted partner in navigating the evolving challenges of collegiate sports medicine. Um, the it's a changing world, rapidly changing world out there, and I particularly value and respect his ability to deal with that, always while keeping the student athlete's health as the main objective.
I know I have,
So I'll
sorry,
go, and
my
then
apologies.
with coaches, I can honestly say that in 30 years, I only had one small disagreement, with a coach about, the best way to go with a student athlete. And, that's amazing when you think of the pressures that they're under. So hopefully I answered your question, but yeah, the team physician is a part of it. Um, Not even the biggest part. I give a lot of the credit to the athletic trainers who are there every single day, taking care of these patients. And with young people, sometimes it's easy to communicate with them. Sometimes it's not. Um, but it uh, it's just so nice to have that support and that level of communication all the time.
Mhm. I have a shirt that one of my friends gave me that says human first, athlete second. And I think that that's like such an important thing to remember, especially with
Yeah.
the world of betting now with athletics and all that stuff. Like it's easy to, especially people you don't know, to maybe not remember that they're human as well.
Well, one of the nice things about the athletes at Central is they're just so motivated to get better, and they're so young and healthy that working with them is a joy. Honestly, it makes somebody like me look good because they have so much potential, and they're so easy to work with, both because they are so healthy and even more so because they are so motivated to stay healthy and get healthy if they're injured.
All right, my next question for you.
Yeah.
How have you been enjoying retirement?
So, it's funny how often I get asked that question. Overall, I enjoy it a lot because I have more time for family that I had when I was working, and it's probably the number one thing. I do miss my patients. I'm a surgeon. I miss doing surgery, and I miss my colleagues. But I still stay involved with the American Academy of Orthopedic Surgeons, the American Board of Orthopedic Surgery, and do a little bit of consulting and things like that. I'm lucky. I still sometimes am able to have a coffee with Ken Kladnick, one of the athletic trainers up at Central, and also the chairman of the Hall of Fame committee. And I still communicate with all the trainers that I worked with up there. So yeah, I miss it. but sometimes there's a time for the next step in life.
I can hear Ken's words right now. You're forgetting Hall of Fame member as well.
Yes. Well, and deservedly so. I mean, he is an incredible asset at Central, communicates in and contributes in so many ways, both with education, through the athletic training program education up there. If he's needed, he jumps right in. He's involved all over Central Washington. I know he's served as trainer at Sela High School and Yakima Valley Community College when they need help. So he's a tremendous asset for Central and the entire Central Washington community.
Absolutely agree. All right, to wrap it up,
Yeah.
during your time as CWU's team orthopedic surgeon, you worked with hundreds of student athletes, coaches, and administrators. Are there any shining moments or stories that stand out to you that are especially meaningful to you?
Well, one thing that I always did when I was at Central is I firmly believe in the private of medical information. You know what I mean? So that makes it a little bit difficult for me to answer that question. But with no names and everything, I can remember a few cases. I remember one football player um, was a linebacker that had a gruesome injury to their knee, where they basically injured all the ligaments, the ACL, the PCL, the MCL, and the LCL, and both menisci. And so it was really, one of the worst knee injuries that I've ever seen. And that's saying something, because I would do several hundred knee procedures a year. Um, and so he elected to undergo the reconstructions, and we really had to put his knee back together. So we basically reconstructed or repaired every ligament in his knee, and we repaired both menisci. And I warned him, that it was quite a severe injury, and he might not ever be able to come back from that. And he worked so hard in rehab, and he brought that knee all the way back, and he came back and he played the following year season, the next year, and he actually made all conference. So um, just the work that he put in, or even I, didn't think that he would be able to come all the way back. Not only did he come back, he came back at a high level. And now I'm not going to say what industry he's working in, but he continues to work at a physically demanding job, which I just think is amazing and a credit to his hard work. Um, so that's one thing story, and I have a million of those about the resilience and hard work that these student athletes are willing to put in to come back. And another one is just kind of a thankful note to CWU, because when I first started covering in early 1990, we didn't always have an ambulance on the field at the time of especially like football games. Um, and to tell you the truth, you don't always need them. But then shortly thereafter, they did get them on the field, and it was infrequent that we needed to send somebody immediately to the hospital, but there were times that we did, and I'm very very thankful for that. And I still remember walking out the first time and seeing that ambulance on the field and saying this is a good thing, and I'm glad we have
I'm sure a lot of people agree with that.
them.
All
So
right, that's all I have for you. Any last comments or stories that you want to share or anything?
um, just the comments of working with the trainers over the year. You mentioned them, and I was lucky enough to work with four of them: Ken Kladnick, um, Isaac Perry, Kerry Johnson, and Gary Smith. And all of them were just so great. And they had that professionalism, leadership, caring attitude, and deep understanding of athletic care. It really made my job easier. And I'm thankful for that. And I think that, I mentioned Dr. Francois and how he, really supported me in that mission of taking care of athletes, both on a preventative basis and a treatment basis. And I'm really thankful for that.
All right, that's all I have for you. I really appreciate your time. Congratulations again, and we look forward to seeing you here back in Ellensburg here soon.
All right. Well, thank you.